This conference will now be recorded.
All right. Good evening, everyone. I'd like to start our August 25th, 2025 Board of Health meeting. Our only agenda item today is our guest speaker, John Briggs from the Pioneer Valley Mosquito Control District. Thanks for coming, John.
Thanks for having me.
The floor is yours.
I feel honored. I don't know how much you all know about Pioneer Valley and how we're related to the state, and we're under the State Reclamation Board, and there are 11 other districts throughout the state. And Pioneer Valley was established in 2017. It's one of the later established districts. If you look at the history of the other districts of mosquito control projects, such as Cape Cod, they were established around 1930 to 1940. They debated because it's them in Berkshire County that say they started around the same time. And it's an interesting history because you think of why mosquito control was established during those time periods. It was all because of tourism. They weren't too concerned about arboviruses at the time. Arboviruses were more down south. You had yellow fever in Philadelphia, that outbreak, the late 1700s. And as far as that getting as far north as where we are, that wasn't really the case because those particular mosquitoes that came over on shipping boats were not able to overwinter. So that's why we never really saw them as far north. And it was they were more of a pest issue up here. And it wasn't until we started seeing triple E more regularly. We did see triple E sporadically in the 1800s, and it wasn't until the advent of asphalt that we saw a huge decline in the Culicida melanorit's primary vector for triple E. It amplifies the virus among the bird population. They utilize cedar swamps. So in that time period, we started utilizing cedar for siding, for shingles, decimated that habitat. So triple E, if you look at the time period, there were kind of sporadic moments where it popped up. A lot of horse cases occurred, and then it just kind of dropped. And now it's sort of coming back because their habitat, there's a resurgence in their habitat, their conservation, which is definitely a good thing that we are conserving that habitat. It's very sensitive habitat and supports a lot of different species, a lot of biodiversity. And so what we do, how we fit in, again, we just started in 2017. I was hired in 2023 as director, first full-time employee. And I expanded our surveillance program on my own. I had started doing all the work in our dining room. So our laboratory was in my dining room. My wife was she was a saint, and we didn't do that for one season. And I kind of had to promise her that this was it, and we have big plans for the future. And we did. We ended up moving to South Deerfield after that. So we had a large office in South Deerfield. We hired 2 staff. So surveillance was even more expanded. And then we started to do pilot mitigation services. And those would include catch basin treatments. And the reason why we target catch basin treatments because the primary vector for West Nile virus is Culex pipiens, and they prefer water that is bacteria rich, has a lot of organic matter, and it essentially smells like sewage. And they are one of the few mosquito species. Anopheles is another one that will be attracted towards that particular scent. So we find a lot of them in the catch basins. We find a lot of them in green swimming pools, not bentine swimming pools, yard containers, any water that's been sitting there for a long time where the bacteria levels were able to multiply, get pretty high. So by treating the catch basins, we utilize Bacillus thuringiensis israeliensis. It's BTI. It's the BTI dunks that you can get in the store. We use a different formulation of it. It lasts, we have 45-day briquettes and 90-day briquettes. So in South Hadley, we would treat with 90-day beginning of the season towards the latter part of the season. Now we're treating with 45 day. That should get us through the rest of the season. And this species will overwinter in the adult phase. You call it the house mosquito, Culex pipiens. You'll find them in your basements, in your sheds, and if your basement has a sump pump that is just sitting with festering water, they'll continue breeding in your basement, which is really incredible.
Wow.
Yeah, so they'll overwinter. They'll overwinter in where they'll come out for their blood meal in the spring, and then they'll be ready to lay their eggs right off the bat. So that's where, treated catch basins will bring down Culex populations. And then when you go into the overwintering season, we're trying to keep those populations down. It is tough, I will be honest, that catch basins are a primary habitat, but when you're in that urban environment, there's a lot of outreach that we try to do to get folks to just empty out yard containers. And then working with boards of health, if you have a swimming pool, if it's a tough case, what I've done in the past is just treat the pool with briquettes until that swimming pool is taken care of. So at the very least, we're taking down that Culex population. You could have tens of thousands of Culex pipiens coming out of the swimming pool.
Wow.
And then we also provide wetland treatments in the spring, and then in the summer too. Northampton will do that, East Longmeadow, a couple of other towns will do that with, we're targeting areas where we have found vector species, bridge vector species, where they would feed on, say, a bird and then feed on mammals. And that would provide the bridge over to us for the virus. And so we're specifically targeting these areas where we found these species. And it really has to be an area that's producing a lot of mosquitoes. We're finding an area in Deerfield, I found several different areas that were not really breeding that many mosquitoes. And then you have other, such as other predatory species, such as dragonfly larvae, back swimmers, dive beetles. The dive beetles in the dragonfly larvae will feed on mosquito larvae, so that kind of balances that out. If we find that sort of biodiversity in these wetlands or these woodland pools, and we just don't bother treating them. So there were several areas in Deerfield that we didn't bother treating because it just didn't make sense. There weren't that many mosquito larvae, and it appeared that it was being naturally balanced out. So we're really looking for, and mosquito are very good at finding areas where there aren't
any predators, yeah.
So we have a seasonal entomologist with us, and this was their first year experiencing things. And there was an area in South Deerfield where it looked like this beautiful woodland pool that you would find so many different species, this richness, and it was all mosquito larvae. Just every dip we did, we were pulling about 50 to 100 or more. We could not even count them of mosquito larvae out of this pool that was probably about 10 by 10. So it varies quite a bit across habitat. And then we moved out of South Deerfield, fast forward. I worked out a license agreement with UMass Amherst, and we're at the Laboratory of Medical Zoology at Fernald Hall. And we have a lot of resources there. They've been great. And we're working on a lot of different research projects for them as well. So it's been a great kind of marriage right now. And we have Dr. Rich as a resource. His specialty is ticks. So we're trying to find a way that we can collaborate and bring them both into what we're doing. We're a little limited under Chapter 252. We can't really do anything about ticks, but we can do a lot of outreach, technically do a lot of outreach. And then we also have Dr. Andrew Lover. He has a lot of experience with arbovirus. Arbovirus is mosquito-borne disease and tick-borne disease. He's a commissioner on the board.
Now, just a question. I know I'm open that. Do you target certain areas?
Yes.
Like strictly like?
Yes.
populated areas or wooded areas with swamps, or
It depends
Little bit of
on,
both.
well, so in Northampton, you have this area that is in close proximity to all these homes. Some of these homes have these wetlands that are, feet from their backyard. So in that case, you're targeting an area that is literally feet away from residential areas. And they get an abundant amount of mosquitoes, especially in spring. A lot of mosquitoes. So we're looking for that, and then where we want isolated areas is for Culicita melanura. We would be very interested in coming into Belchertown and finding where they're coming from. Because you have the squavin, so the squavin is providing these areas. Culicita melanura needs to overwinter in a permanent water source. They're in the larval phase. If that permanent water source isn't there, they're not going to utilize it. And I suspect that you guys they'll utilize red maple swamps and red maple swamps and cedar swamps. And as long as they're permanent.
Right.
The only cedar swamp that I know about this way is Wilbraham. And we're trying to get in there too as well, because that is a great spot for melanura. And the idea is, if you go into an area, you're able to effectively treat. That's one of the research projects we're working on with UMass, is figuring out a way to effectively treat these areas where we're finding Culicita melanura, very specialized habitat. They'll utilize these crypts that are covered in sphagnum moss that provides enough protection to prevent them from freezing over the winter. So they're underneath that root ball that's covered in sphagnum moss, which is why we call them crypts. And it never gets to a freezing temperature under there. And that water needs to stay at a certain level. If it dries out, then obviously the larvae will die. So those are areas we would like to find with surveillance, adult surveillance, figure out where they're coming from, because of, you guys had that first triple E positive in Coquelicity perturbans, and that's a bridge vector. Very unusual to find it in a bridge vector first. Usually with this stuff, it's not always predictable, but typically you find it in your primary vectors, such as Culicita melanura, and then once it amplifies in the bird population to a certain extent, it's going to spill over into bridge vectors, like Coquelicity perturbans. But it was very interesting that it had been found in those bridge vectors first and not Culicita melanura. And what we've been doing as a response is we've been getting as close to your border as possible. And we know where the trap site is too, so it's about a mile away. And it took me a little bit to find it, but I found it. We've been submitting Culicita melanura. We have not found any triple E, so that's definitely, that's great. It's good news that it's not that prevalent in the area. At least right now, it's not that prevalent. So I know Granby is pretty happy about that.
Yeah.
Okay, first, quick one. You are a state employee?
Correct, yes.
Okay. You're going to all of these different locations. Do you need permission to walk on property?
No, technically under chapter 252, we can go on private property without permission, but that's not what we do. We always talk to the homeowners. I've been doing this for, over 10 years, and then at Pioneer Valley, 3 years. I've only come across a handful of people that say, no, I don't want it on my property, which is kind of a red flag, because most people, when they find out what you're doing, they say,
They're all for it.
thank you so much,
Yeah.
this is great, we want you to put the traps on the property. We've been kind of going away from that. We're trying to find more public spaces, because you can kind of open up a can of worms if you're trapping on private property, and they can deduce where the positive is. The last thing we want is people, panicking, because there's virus.
Well, the worst is you don't want anybody with a gun going after you.
Well, yeah, that's happened before, but.
So we also have the Tri-Lakes, and we have the Swift River. I think those probably are our biggest, but we don't have an outdoor pool, I guess.
You got Lake Wallace as well,
Well, we
it's very
Oh, and
swampy.
Lake Wallace.
There must be
Yeah.
a lot of
we have,
mosquitoes
We're
there.
also,
Yeah, the Jagus Brook
Geographic-
tributary.
geographically, largest town in probably Western Massachusetts, probably even if you went back into Worcester. So we got a lot of land and a lot of variability, and we have populated areas and unpopulated areas, and areas that belong to the town, and others that are protected in other ways. What do you need from us? Or,
Yeah.
You know, why are you here?
Well,
Other than
So
to
you
tell
guys
us
would
what-
like to join.
Yeah,
Yeah, what does it take to
The
join?
process
Right,
would
yeah,
be
tell
that
us
you
more.
would provide a recommendation to the select board, and the select board would petition on the town warrant to join the district. And then you have a second vote to allocate the funds, the annual funds. So the membership cost is $5,250 annually. So that includes surveillance. And then you also have a buy-in to all the mitigation services as well. So those are at an additional cost.
So our board does not join, because we join like the tobacco stuff as a board, and also as a Quabbin Health District, we have memberships, but this would be done by the select board.
Correct, yes, select board would ultimately petition to join the district.
And is it typical for that cost to be borne by the local board of health, even if the select board, I guess I'm thinking about
It depends on
out
what,
of whose budget it might
They'll
come, or
take the
does
money
that,
from anywhere.
typically,
vary?
I've often wondered if it's easier to do it from like free cash or wherever.
Right, right.
And, you know, because I know boards of health are very tight,
Tight,
you know, you
right,
guys already have constrained budgets, so wherever it, I guess if it come from where it's appropriate, that's fine. If we can, as long as it's coming from a municipality, we can take the funds.
are there additional costs, or is it just really that membership fee?
It's the membership fee, that's it.
That's
And
it.
that covers surveillance, and we provide surveillance on a weekly basis. And we find buyers, we're doing more than once a week traffic. We're doing supplemental traffic, like in Granby, even though we did not find triple E, there was a lot more traffic going on in Granby throughout the week, so it was more than just once.
Andrew, could this be done through the Quabbin Health District?
Oh.
Would they be interested in the other towns? I bet you Pelham would be more interested.
Well, from the excellence, I don't know if you're inquiring about the excellence grant, which it would have, all three towns would have to, we didn't budget for that for FY. For
Right,
this fiscal
so I'm
year.
just thinking though, that might be another source of funds, and, you know, if you told the Ware Select Board and you told the Pelham Select Board that it would be free to them, they would be much more likely to do it, and obviously it would be better for him, and they're in the Pioneer
I mean,
Valley.
grant funding goes away, so I don't
Well-
wanna set this up where it's, you know, potential for, I think we should start with going through the select board and then figuring out if this is something that the board wants to recommend. You know, if it comes down to the town doesn't have the money and they don't, you know, want to use municipal funds for this, then we can try to figure out alternative avenues,
Right.
but,
I know, I wonder about some of the nonprofit groups that are interested in some of the conservation areas, the wetland areas where, I don't know, I'm just thinking, yeah, I think creativity around thinking about, although, you know, in the scheme of the entire town's budget, that is not necessarily a huge amount. It's a bigger proportion of just the Board of Health's budget here, but that doesn't seem unreasonable. It sounds like there's a lot of services. One quick question I had too is just, can you talk a little bit more about how in the towns that have joined, how you do some of the public education, or how you work with the Board of Health or other groups to let the public know
We'll do listening
what's
sessions.
happening?
Yeah, we'll do listening sessions, we do
Okay.
one with Shutesbury, and then we'll even do them with towns, for Hills Health District.
Mhm.
I'm gonna be doing a listening session with them, and so it doesn't matter whether you're in the district or not.
Or not,
That's
or-
something
yeah.
that I think that, because we're about public health first, it's not
Right,
just
right.
spreading the word on it. The most important thing in all of this is people just becoming more aware and utilizing EPA-approved bug repellent.
Mhm.
Right?
Mhm.
And Last I heard, mosquitoes don't pay attention to town boundaries.
They do not,
Do
no.
not, right.
Unfortunately, they don't.
John, do you have a template proposal?
I can send that to you, yeah, so we do have a template, yes.
Okay, that the Board of Health could maybe sign and give to the select
To the
board,
chair,
pass it
outlining
board, yeah, I think that
what
would,
everything
Right. and maybe,
goes towards and the
right,
cost.
what the costs are,
Yeah.
what some of the benefits
Like-
are. I think, you know, on another committee that I'm on that has to go in front of the select board to advocate for money to be spent, you know, what are the benefits of this and also what other towns? Sometimes our local select board, you know, likes to hear what other communities are involved and that they see a benefit to being a member of this, so that the investment of that membership fee is worthwhile, it sounds like. You haven't had any towns that have decided to drop out after being a part of it, so my
We
guess
just send the
is that,
mosquitoes in.
you know, that to me indicates that they think it's worthwhile once they've
There-
joined.
When I first started, there were towns that were unaware of, because they had, and not to knock the person, but they were a contracted employee, and they were only working like part-time.
Mhm.
So they couldn't do everything and then do outreach and
Right.
communicate with towns. And that's something that I've been trying to do more and more of every year, especially now that I have extra staff. So we send out weekly reports to all of our community contacts. We let them, that gives them all the results, gives them all our mosquito numbers, it breakdowns, all the different species, you know, where you can find these species, whether they're mammal biting species or bird biting species or both. So that's a huge component to our district, is to provide this outreach and stay in contact. Like I said, there were a few that were unaware of it and they had thought about dropping out, and I had some conversations with them about what we do. And then they said, nope, we're staying in.
I'm thinking actually, you know, if there were reluctance, and there will always be reluctance if you want to spend $1, that could be brought up under the recreation advantages, because the town beach is really popular,
Mhm.
and so is the Swift River. And,
And all of the trails.
and we did have a
Mhm.
case of Tripoli, and I think it was 2013.
Yeah, it was
We
a
had
horse case.
died.
Horse case,
And then there was a little girl up in the town of Orange who contracted it.
Yep.
She survived, but we don't know.
But even, you know, just our ball fields.
Right, I was gonna
Rec
say,
for
right,
sports,
right,
out behind
stuff that
Chestnut Hill,
happens,
the backside there. I
And
mean,
then we also have the Troy Lakes.
Right, you have Charlie Lakes, you've got, again, all of the,
Yeah.
with the emphasis on people using a lot of the wooded areas, the waterways, the beaches, the, you
now,
know, trails.
just a
More, we're
random
encouraging
question
people
for
to
you.
be outside, so.
If, now that more towns are seem to be coming into this, joining this, do you have any like plans of like expansion? I mean, you put the traps in and feet on the ground, basically, right? For these bigger areas, like we have a couple big, huge swamp tributaries that are full of water year round. Do you ever like thinking going to that next level of like an aerial attack? Something like that, or does it
Yes.
always be boots to the ground?
So, that might be a little tough, right, in these areas, but the product we use that BTI. It's a naturally occurring soil bacterium. It basically, it is non-toxic to mammals. It's very safe. It is the safest product that we could possibly use, which is why we ended up going with it. It's effective. It's been used for over 40 years. Well, there's over 40 years worth of data. There's no resistance that has developed with BTI because of the way that it works. So a helicopter treatment would be a larval treatment, targeting those large areas with BTIs. We do have a vendor that other districts go through that we would just tap into if that was
Yeah.
something. that
I'm just
towns
thinking, because,
were
you know, a lot of
interested
our
in.
subdivisions are around wetland areas, big, huge wetland areas. So you got houses pretty much surrounding every
Yeah,
360
I
degrees
think-
around the thing.
Gail and I were both on the select board at different times. There was once a proposal, I think, to do aerial spraying or something, but we thought it
Well-
was very expensive.
Yeah, well, and the concerns about, and honestly, concerns about some of the impact on some, community concern about it. When we had that case, I was on the board, I'm just recently back on this board, but I was on the board when we had the case with the horse. And it was in September, so you may, recall that, our annual big Belchertown Fair happens in September. Thousands of people coming and goes all night long. So lots of concern about would people be at risk? What would we want to do? I do believe we ended up doing some things on the ground, but not the aerial stuff because that raised some concern amongst people and what might be the impact not only on, fauna, but also the impact on humans, impact on kids, impact on older adults with an aerial thing. At the same time, I think the good news was that the community with a fair amount of education understood the risks around what some of these, both
Yes.
Triple E and West Nile virus, what some of the health risks are. So I think that's helpful for people to see that taking some action doesn't have to be, always a no-go kind of proposition because the public health risk is of concern along with, trying to minimize any risk to people from the actual intervention.
We do have a triple E response plan.
I saw that in your
Yeah.
notes, which I think is great,
So
yeah.
we have it through, and I say with Central Mass Mosquito Control
Okay,
Project, they have a lot of trucks, so what they would do is lend out one of their trucks. It would either be backpack or truck ULB, and it would be very small, precise, targeted areas, where we're finding triple E.
Yeah.
But that would be something that we wouldn't say, we're doing this. This is what we're doing. This is
Right.
something that you guys would have to decide. Is it something that you want to vote on, or is it something that the select board is going to vote on? That's totally up to you guys how you want to vote on. So my job would be to present it to you. This is the plan for how to address this, and this is what it all looks like. These are the costs, and we're looking at costs for just, the products and all that stuff, so it wouldn't be too expensive. And so that would be, again, totally up to you guys after I send my recommendation, whether you would want to follow through with that. But I imagine it would be significantly cheaper than what you guys had back in 2014.
I know, I don't
You guys
even-
have a private company.
I think so.
Yeah,
If my
Clark.
memory serves me, I think it
Nothing
was a
against Clark,
private,
great.
right.
But they come from Illinois, so they have to bring all their trucks out
Oh, wow.
here, so it does get pricey, and they gotta cover their overhead.
And, we had a lot of other kinds of costs. They had to change the schedule for the high school football games and
Yeah.
cancel
Right,
the
right.
fireworks after the fair and a whole
Right.
bunch of
Other
stuff
other
like
things
that.
that happened, right,
They may not have had a lot of money, but it was a lot of effort.
yeah.
Oh, go ahead.
I'm just having a thought in my head about the timing of this. Are we thinking, you're thinking, Andrew, get this to the select board soon, but you said it has to go to a town meeting and has to be
Yeah,
a
so
warrant.
Well, they'd
so-
have to come, somebody would have to come up with the money.
Right, so we're
They can't
talking,
put the
trying to
money
think for
without
next
town
year,
meeting.
for next year's town meeting, May of 26 town meeting.
Yeah, unless they
Okay.
came up with the
Right.
5,200.
To figure
Before
out, right, to have a plan, get it on the warrant, have their support. That, to me, also, I think, gives us opportunity to get the support of some other groups that might be useful and helpful in persuading, and helping the select board see the benefits. Okay, so we're looking at a
How,
plan. Go ahead.
how is that number calculated? Number of people or size of area, or it's just the same for, would
Same
Pelham
across
have the
the
same?
board.
Pretty much a
Pelham,
flat rate.
Pelham would
So-
charge the same?
That
We're very
number should
different.
City
be-
of Boston?
We're very different from the cherry sheet districts, called the cherry sheet DOR, and,
Yeah.
comes out with everything every year, and equalized land value is calculated in that. And so Central Mass uses the cherry sheet. So you have a city such as Worcester, a lot of land space, lots of water, and they are paying probably over $200,000 a year for services. That includes everything. Catch basins, adult deciding, larviciding, outreach, public education, all that stuff is all wrapped up into that. But other towns, it would be different, maybe it's a smaller town in like Hopedale, very small. They're probably paying around $50,000 or something like that. I'm not sure entirely what they're paying, but so the cherry sheet, the way the cherry sheet works is that's not coming out of your budget, as you guys are probably aware. That's just extra funds that gets distributed by the state.
Right.
And so how that works with those towns is like, well, it's not coming out of our budget, so it's not really a big deal. And they've been doing this for decades. Like I said, we just started in 2017. Central Mass and other districts that utilize cherry district have been around for decades. And you have these towns that are very used to, allocating those funds for mosquito control. And then we are one of two districts that utilize the voluntary appropriations. And East Middlesex is the other one. They have Sudbury, Weston, they have all these very affluent towns for their membership buy-in. Does not include surveillance, is over $7,000. And that gives you a buy-in to services. And everyone wants surveillance. So then the surveillance, they calculate the overhead for surveillance, and that comes out to probably about $4,000 to $5,000 in addition. And then any other services they're interested in tacked on. So it's the way that my commissioner set it up is that they wanted it to be a low price that is affordable for all towns. Makes it a little challenging for me to make it work, but we're doing it, we're making it work. So the mitigation services really is where it's helping along with the budget. But my goal is to get as many towns as possible, especially bordering towns would be great to close those surveillance gaps. And it is all surveillance. That's our main focus is surveillance, and then public education, outreach.
What towns do you have in Hampshire County? You mentioned Northampton.
In Hampshire County?
Yeah.
Hampshire County, we have Northampton, Southampton, we have South Hadley, Granby. Missing one?
You don't have Amherst.
We do have
Do you have
Amherst.
Amherst?
I missed it.
Okay, got Amherst.
Sometimes
Oh,
I
you're gonna be
consider
very
that
you.
Franklin County.
Yeah,
It's so bad. Yes, we have.
And you
Amherst.
don't have our neighbors, Pelham and Ware.
No, we don't have that.
How about,
That's 2 or 3 of our neighboring towns.
Yeah.
Southampton, Amherst, Granby, is it Granby?
Yeah, Granby is in the district, yeah. Mhm. And then we're looking to get.
Ludlow would be the other big
I
one.
know, yeah.
Ludlow.
Ludlow, yes.
Oh, you have Ludlow?
We don't have Ludlow, but we would like to get, we'd like to get Ludlow and then work our
Well,
way
yeah,
down.
I'm
to
looking
Ludlow.
at our neighboring towns.
Yeah,
Do you have Palmer? No?
we do have
You do
Palmer,
have Palmer,
yes,
okay.
yeah.
Well, that's right.
Yeah, we have Palmer, down in Hampton County, we
Mm-hmm.
have West Springfield, East Long Meadow, Chicopee, Holyoke, Palmer.
Wow.
Yeah, we have 24 towns. Montague just joined, so that's 25. Leverett is joining for next fiscal year. And Agawam is hopefully gonna get some funding they tried this year, but the funding didn't come through, but they really wanna get in, so hopefully next year works out.
Good.
Organization of Massachusetts, let's not go there. Okay.
Yeah. Any other?
So, yeah, I guess we can make a motion. What would be the appropriate motion, Andrea?
I mean, just to bring it up.
So
Yeah,
we make a
Get-
recommendation to the
we
select
can
board
vote to
and the
make a
town.
recommendation to the
Yeah.
select board.
And the town.
Using
that
your
we-
template and
We join the.
Yeah.
Yeah.
Oriented
and
Valley
get on a
Mosquito
future
Control
agenda
District.
of the select board. Okay.
That's what I would recommend,
Mhm.
especially with the two, cases.
Yeah.
I think it would put a lot of the residents that are concerned at ease that we're doing, the town's
Right,
doing
right,
something to
right.
address this,
Mhm.
especially because we have events, Food Truck Friday events and then the fair, and that's all during the summer months going into the fall that,
What are the locations of the two cases? Where are the locations of the two cases?
we don't know.
They don't tell us.
No, they
You
don't, they can't tell
Oh, of
us
course
where
they
they're.
Right over there.
They say
Confidential
Yeah.
information. It's interesting because if you look down in Connecticut, they publish all their sites, but it's all public.
Right.
And I think that might have something to do with it as well. But
But I would think they could say south Belchertown or north.
they give you a section of the town, and then I make maps, which I can, if you guys are interested, I can forward you the weekly surveillance report. It's not a big deal, I can just add you to the mailing list. And you can kind of see the general area where we've had West Nile virus and Triple E.
Yeah, I think.
that'd be interesting to see, yeah.
Now, West Nile
Yes.
has been mostly on the eastern part of the state, but I just heard, did
We've
Berkshire,
had it up
did
here.
Berkshire County get it?
Yeah, Berkshire's kind of, we've had 23 positives.
Oh, you have?
Yeah, we have 23 positives. We had 3 up in a row. That is the first time they've had it. And I'm sure they've had it in the past, it just never had like comprehensive surveillance. I know DPH would get up there maybe once this summer, or twice this summer, when we weren't around, and that's not their fault. They're limited with their resources, and
Yeah.
Yeah, they closed the power,
Historically-
they closed the power plant, so they're limited on resources. Nuclear power plant had taxes.
But we found it in Northfield as well. Northfield never had West Nile virus. Working our way down Leiden ended up having it, Deerfield. Skipped over Sunderland, Amherst, and I'm sure we'll find it in those towns eventually.
Eventually, yeah.
And went down to Northampton. Northampton had a lot of positives so far this year. West Springfield, East Longmeadow. Shelburne was the other one up in Franklin County that I was surprised.
Okay, well, they're most of those are northern Franklin County.
Yeah, northern-
Northfield is right on the border,
And to be
so is
honest
Rowe.
with you, I came into it thinking like, it's gonna be a rarity to find West Nile virus. And looking at the historical data, it's just like once in a while it would show up in Leiden, but it never really showed up anywhere else. Berniston it showed up once. And so I thought maybe once in a while it'll show up. I didn't think it was gonna do what it did this year. And I think it was the Keelix did really well overwintering, and the spring was wet, so they did well with that. And they really got out and amplified the virus. And it's endemic, so it's gonna occur every year. It's always gonna be there. So I think their population numbers, we're seeing them across the board, are really high. And the highest that we've seen, at least in the past 3 years, it's not that long of a time to look at historical data, but we're typically seeing, I'd say in previous years, and then my experience working at Central Mass in the laboratory, identifying mosquito species, we would get 20 to 30 in one trap. And we are now getting hundreds of these mosquitoes in one trap. And that's why I submit as many as I can, and we're getting a ton of positives from it. The silver lining with that is they're mainly bird feeding mosquitoes. They prefer bird feeding because they'll generate more eggs with that blood meal. They will feed on us from time to time, so they could, provide that bridge for the virus to get over to us. But we're really looking for spillover into Coqueliceti turbans, canadensis, Aedes vexans, Claritated japonicus, all these different bridge vectors that are competent vectors for transmitting the virus from say the bird over to us.
At least 3 of those towns are on Vermont and New Hampshire borders. Do you relate
Yes.
to those states?
Yeah, so Patty Casey's up in Vermont, and they have, I think, 5 programs that they're running.
Oh, Royalston is on the border too, right?
Where?
Isn't Royalston on the border with New Hampshire?
Yes, I'm not sure which side.
No, it's not,
and
well,
which
it's not
was
Franklin, no, it has nothing to do with
Going
him,
up
but
that way, but.
mosquitoes don't obey the. So you relate to them also.
Yeah, I look at what Patty Casey's doing. The biggest thing is looking at the southern area, because usually that's with disease dynamics, usually you're seeing it down south first.
Right.
So in Connecticut, look at Connecticut,
All right.
they have no triple E cases this year.
Wow.
Which is just goes to show you,
Wow.
you can't predict anything.
Wow.
So you could say typically this is when it happens, but it's not 100%.
Yeah.
And then you look at Rhode Island. Rhode Island, you know, they're doing a lot of surveillance in recent years, and what's interesting with them is I noticed that they had a West Nile positive in albopictus. Aedes albopictus is an invasive Asian tiger mosquito species who bite during the day in the direct sunlight. It can transmit dengue, chikungunya. And so it's a scary mosquito, not necessarily because of those, you know, you take a lot of people coming over with those viruses because it's from mosquito to human, it spreads that way. But if they're becoming competent vectors for West Nile virus, that's a bit concerning. And then maybe triple E, they're gonna start becoming competent vectors for triple E, because they're very prevalent along, you know, Bristol County, where you have a lot of shipping coming in.
Yeah.
They come in through tires. We found them in West Springfield. It was a tire retreading facility. And I looked at the satellite imagery and I'm looking for tires. And it just stood right out. And I said, that's the spot where we're gonna find them. And we found hundreds of Aedes albopictus there. So we tested a lot of them. None of them came back positive for West Nile virus, but for Rhode Island to find West Nile virus and Aedes albopictus, and we're just gonna keep on sending them in for testing.
And climate change ain't helping you.
No,
right,
yeah, so they'll overwinter right now. They're artificially overwintering in these tire piles. So you have these tire piles, like at this place that
Right.
I surveyed. You have these tractor tire piles that are up
Yeah.
11, 12 feet in
Right.
the air. At the bottom, if you were to take a thermometer
It's
and put it
super
at the
warm,
bottom,
right,
that's,
exactly.
yeah,
Mhm.
it's warm enough for them to overwinter the eggs.
Yeah. Wow.
And like you said, with our windows being so warm, we have more and more population.
Yes, yeah. But you can see through climate change, you can kind of see them, they're working their way out north, yeah. Where they're naturally established, where they can overwinter, they can survive winters. I believe New Jersey is furthest north.
It'd be good in the proposal to put in all of the places of concern, the areas of concern that we have.
In the town
Yeah.
itself, yeah.
Because
all
as
the
you're mentioning
geographic
tires, we
areas,
do
right.
have a location in town, I think towards Amherst, is it,
Yeah.
on that line, where.
Yeah, they pile it up, they kind of use to cover things.
Right,
So,
the kind of
silage.
places that you,
Yeah.
right,
Pete's Tire Barn in Orange, they
Right.
put up, overall Orange, I mean, I don't know
Mhm.
if it was because of that, like, just let, I know that it.
Okay, so I made a motion. Did anybody second it?
I don't think so, I'll second it.
All right. All in favor?
Aye.
Aye.
All right.
Got that far. You gave us a good education.
Yeah, appreciate it, John.
Great,
Short-
yeah,
short
thank
talk
you.
out
It's
loud.
helpful.
Thanks for having me.
Where I lived on Bay Road, till recently, it was major wetlands by our house. It
Yes.
was wet all year long. And there was lots of dead wood. So there's lots of, whatever you call it, for having things hibernate. They swarming. I would love to see that location tested. I don't live there anymore, but I still have a affinity for it.
Yes,
Yeah,
that's definitely an area that I noticed, favorite.
yeah.
Okay,
Thanks, John.
thank you for
All right,
coming.
thank
Good. Good luck.
I'll be in touch with should I send you?
Yeah.
Okay, I'll send it to you.
And I guess that'll go through Steve Williams probably, our administrator.
Yeah, I'll send you all the drafts.
Okay.
I mean,
I mean, would it be good for us to come? You would probably make the presentation, right?
or
you would.
if you want
I
to
can
come back,
join too, yeah, that's fine. That's what I ended up, that's what I did with, Montague. I said, first at the Board of Health and then with the Select Board. That's okay, I'm doing that.
Okay,
Perfect.
you rattle off those names, you see those.
Right, yeah, they need that. We can be a show of support behind you, but
Those are all made up. I just
you
made
can,
them.
you can definitely rattle off those Latin and Greek names of the mosquitoes.
Okay.
All right, thank you guys.
Thank you.
Appreciate it.
So that does it for our one agenda item.
No,
Now
we
can
have to
go
hear about, there was a report, right, about, Krispy, Chubby and Krispy.
On our discussion items, yeah. We have,
I think we have both.
we have both,
Oh,
both
they're
on.
here. Oh, I
Yeah,
didn't realize.
they're showing the go.
All right, well, why don't we do Chubby's first?
So we put this on the agenda. So anybody that does frozen dessert manufacturing, will usually like the machines, the soft serve machines, the regulations for that, they have to test monthly and submit to us the results, because sometimes they can be in exceedance of what the standards are. So they're testing for usually total coliforms, they do like standard plate count, and we get those results. If the results are in exceedance, the machine as a protocol is shut down, then it goes through a sanitizing procedure, and then they'll do a retest, and then they'll put it back in business when everything is fine. The issue that we had been having, the first one, Chubby's, which I believe is resolved at this point. We haven't had any exceedances with the plate counts and with the coliform testing, which is great. But we had some issues where we weren't receiving some of the monthly testing, but it turns out that they were closed, or they shut the machines down for a certain amount of time and the testing just wasn't being done. But that wasn't communicated to us, and the department just wasn't getting those results that we needed. So that communication was cleared up today. So moving forward, they understand that, they're not going to be using the machines where they're closed for vacation for, a certain amount of time, or right, they shut the machines down. Sometimes people might do that during the winter months when it's not so busy, so no point in keeping them going, just to let us know. And so we know not to expect the results of that time. But we do have Anthony on the go-to. I didn't know if there was anything you wanted to add to that, Anthony?
Yeah, Anthony's mic is on.
Yeah.
Okay,
No?
we don't hear you.
I don't know if, can you hear me?
Mhm.
Oh,
Yeah, we can.
Yeah.
This is Jennifer St. Peter. I'm also a partner for Chubby's.
okay, okay.
I guess he may not be on. He's at work right now. So he's at another job. So he might be pulled away at the moment. But we understand all the obligation now, and we will have the testing even if the machine is down or for service or whatnot going forward. We will notify everybody what's needed. We just didn't realize prior, so we apologize.
Okay, thank you for waiting through our meeting.
Yes, thank you.
Anthony is on now, by the way. We
Mic
can't
is off.
hear you.
I know, we can't hear.
Anyway, so Chubby's is good.
It
Yes.
sounds like it's.
Yeah.
And you're comfortable with the plan for future communication.
And they've always
Great.
communicated before, is it just something that just kind of just started? We've
Um,
never had them really come up with this before, right?
yeah, sometimes we have to chase people to get them.
Right.
I mean, it really depends on the situation. If they change, some places will change vendors who do the testing, and then there's a lapse in time and we don't get anything and we're not sure. And in this particular case, they had just
Okay,
closed or
perfect.
discontinued the service for that machine. And, we just weren't getting the testing, but moving forward,
Yeah.
they know that they should notify us. Otherwise, the regulation says monthly, as long as they have that
Right, right.
The next one.
What about Krispies?
For
Yeah.
Krispies is a little bit different of a situation. We did notify them and let them know that we were going to be having this discussion. We have not received their frozen dessert manufacturing testing since April. And in the past, they have had exceedances where the machine did have to be taken out of service and gone through a sanitation procedure in order to be retested. There's also been a lack of communication, and they've been difficult to get in touch with. Sometimes our inspector will have to just go right there. But we've had in the past issues with the permit renewal. That was going to be on the agenda because it was just, letters were sent. John had visited in person to remind them, you need to renew your annual permit. We don't have that. Technically, you don't have a permit to operate right now. And it was to the point where, town manager was involved, and there was the other thing with the taxes, the tax delinquency. So, but that has been resolved and the permit's been issued. But again, it was the same disconnect in communication that we had with the establishment. And we're getting the same thing in regards to this particular issue with not receiving their frozen dessert
So
manufacturing
you're still
permits.
in the process of like following up with them still?
Well, if the concern that, we obviously have is if they're still using the machine and there's an exceedance, and we're not aware of it, we don't know, because we're not getting those
Public
testings.
is vulnerable.
The public is vulnerable.
And typically, the labs that do the testing will send us via email the monthly test results. So the fact that we're not getting that from a lab could mean that they
They're not
don't have a
submitting.
lab that's doing it,
Right.
and they're not getting it tested. But as far as I know, the machines are still up and
Do
running.
you have a recommendation for us? Should
Now,
we
what,
suspend their?
suspend it?
Well, we were hoping that they would be on, but the permits get renewed, is it February?
Yeah.
It's not like a
Yeah, well, we
January
could probably,
1st
we could
renewal.
probably suspend it if they're in
So,
violation.
yeah.
I mean, tell them we're gonna do it on, pick a
Give
date,
them a particular,
If they
give them a
don't
time frame and say.
come
Yeah.
together.
Right.
I mean, we did the thing on the taxes and they paid it.
Yeah, so give them the 30 days or 60 days, whatever, to
Yeah,
get it.
maybe,
They have like almost 6 more months left
Yeah.
until
Until the
the
renewal
permit
for
renewal, yeah.
next
I
year.
mean, I'd like
They
to
don't,
see us
yeah.
take some action.
So this was kind of the first step, is notifying them that this is going to be discussed at the board
Tonight,
meeting,
right.
Right.
hoping that would,
And this is the way we're leaning,
yeah.
is we'll give them X amount of time to get us the results, or we'll suspend their license.
Okay, so we can I can draft.
We
a
would
letter.
probably have to vote that, so
I
it
know,
would be
we'd
in our
have
next
to vote
meeting,
it,
but
right.
they should.
At least hear from
respond.
what we're thinking anyway.
So I can draft a letter and, hi,
Hello,
are you with Krispy?
John Ritter with.
Yeah,
Select
John.
Board.
Oh,
Oh,
okay.
yeah.
I'm just gonna keep my mouth shut when it
Yeah.
comes to
You
people.
can tell from the Belchertown,
So,
No worries.
Are you here for any, I wish you were here, because we just got done talking about the mosquito control.
Oh,
and they're gonna come to you.
But ultimately,
We
it'll
read
come to the
We
select.
just
board.
voted to recommend that you approve him, but we'll.
Perfect, you can fill me in afterwards, and I'm happy to bring it. I don't know if this is the perfect time, but I did have a question for the board, if that's,
Okay,
whenever you're ready.
all right, let's just finish with this.
So I can I'll draft a
Yeah.
letter and give them until the next Board of Health meeting.
Yeah.
Like 30 days.
To submit the
Right.
test results.
Um,
right?
If you make clear, we would,
August.
May
we
through
make clear,
August,
we
right.
would consider suspending the license if they
if we don't
ignore
have
us.
it,
Right,
Right.
and that could be an action taken at your
Right.
next.
right?
Right.
Okay, that sounds fair.
Just a quick question related to that. In the worst case scenario, if there is, what's the risk to the public in terms of how compromise that kind of machinery could be in terms of anybody going, if we give them 30 days, for example, it's still summertime, people are still eating ice cream, soft serve machines.
This is Krispy's not,
You can get basic from the duty sourcing machine.
Right, I
this
guess
is Krispy's not providing us with certification as required that their machines.
that their
been
machines
cleaned.
have been, or meet the standards,
That the
so
bacteria
that the
levels are-
bacteria levels are not. So I guess I'm just asking, because I don't really know how, what might be that worst case scenario. Might someone be sickened by,
Well, of
No,
course, otherwise it
definitely.
wouldn't be a reg.
Right.
well, sure, but I
it
guess
might
I'm
just be a
wondering,
stomach virus that goes away.
so how much time do you give them to,
I wouldn't
Get
give them
those
a shot.
reports.
She makes a lot of people really sick in 30 days.
and that was my concern, Colleen, that, if these tests have been done, you haven't received anything since April, you said,
Oh, since April.
since April of this year, so we've gone a good part of the spring and summer ice cream eating season without having those reports. I don't know, I guess that's what I was asking too. I was thinking of something a little quicker than a 30-day time period to get those reports, and if there's anything of concern, then they need to rectify it quickly, because there's still plenty of opportunity for customers to
So
be
what,
eating.
so
that.
what are we asking Andrea to do?
Well, I think go ahead, the
I don't think
letter
it's unreasonable to shut the machine down.
Until it's
temporarily
tested
until you get those.
or cleaned or however they want to do it.
Okay,
It's,
we just require they immediately
you
shut
would
it
have to
down.
go back and check and
Check
make
them
sure
again.
that
We don't
it's
shut the
still
business
Right.
down, just shut
Right.
the
shut
machine
down.
down.
Right.
I mean, they can, it's only a few days to get it back up if they do the necessary.
If they do the
inspections.
necessary,
I swear,
Yeah.
college
Testing and
insults the machine. Every night, the machine was taken apart, and all
Right.
the insides were put through the dishwasher.
Yep.
Very hot water.
right,
So it's serious. You really
I mean, it's
get a lot
been
of
since
people sick.
April, why not?
John,
Make it
we-
effective
we-
right now.
When they weren't paying their real estate
that's
tax.
what I guess we're wondering, right,
Suspend,
whether
suspend it now, so they have to take it offline. They can't use it until it's tested and we have
And
copies
we
of
have
it.
And that wasn't even our money, that was your money.
So make it immediate, tomorrow. Agree with that? Make it-
Does that,
make it
does that
tomorrow.
seem reasonable? Yeah, I could agree with that, yeah.
Okay.
Last thing you want is, everybody brings the Little League team to go get ice cream
Right, right.
and kids and adults are not feeling so good afterward because of,
Next game was canceled.
Might lose some games.
Yeah, I think of it as a lawsuit if you know there's a problem, you're not identifying it, it's a
Yeah.
lawsuit waiting to happen.
Yeah.
Okay. So we don't
Okay.
inspect them ourselves for that. They have to go to a vendor who certified and sends us.
correct,
And we also check though as a food place.
for sanitation issues.
Right,
Mhm.
but this is separate from
right, so the
that.
frozen dessert
Right.
gets contracted, they use an outside person and then send a
That comes
report
and
to the
takes the
board.
sample, brings it to the
Right.
lab, gets
Right.
tested, and then we get the results.
You get the results, right?
All right, well, okay, our next discussion, one, we have John, just came in.
I'd say, well, I've been on triple test tonight, I'm not your liaison, but I just wanna show you my face, who I am, I haven't met all of you, when I'm Jim, I met you a long time ago, I was a little younger. So, I'm here if you need me, I know you have the liaison, but I just wanna reach out to the name to a face. The question to the board was, I'm not sure you guys are aware of the well stuff that's going on in Belchertown. I'm just curious if we know a data point for that. How many people in Belchertown are affected by the well issue of the high levels for tracking that by the Board of Health? Yeah, I know it's a nuance set, but it'd be nice to get that data so we can go to our legislators and say, hey, XYZ wells are affected by Belchertown. Is there anything the state can do to help our residents? Because they gotta put a $4,000 plus system in their house. So this is something that, I know Turkey Hill's affected, and a bunch of them, but I don't know if we can get that data somewhere from someone.
So the data is private between the resident and the lab. The resident has to release that information and allow the lab to send it to us.
Okay.
So I do not have a lot of data. I only have in the beginning, they sent me some streets And I think like maybe 5 or 6. But I know since then, a lot more people have had their well tested since we did the notification in the Turkey Hill area. And I haven't received any of those results. It stays with the lab. I do know we've gotten some phone calls in regards to the letter, and some people are wanting to take action, and especially if their results came back on the higher end, that they feel more comfortable putting in some sort of treatment system. Some that can't afford it would just prefer to drink bottled water. Some might not want to do anything. The issue is we don't know where the rocks are and what the rocks are going to contain, because they're underground. It's what the well is drilled into. So this originally was brought to our attention by Quabbin Analytical because they had seen a couple of tests coming in that area that the results were coming up high. And they felt that they should let me know. At that same time, we were doing the well testing program with the Public Health Excellence Grant. And so there were some people that lived in that area that knew just through word of mouth, because it's a small area, people are talking, that attended the private well workshop and ended up getting some, some of the free tests went to some people in that area. But it was recommended by one of the residents that attended the workshop to notify, could the Board of Health please send out a letter and notify the people in this area, because there's still some that don't know through word of mouth, and they just felt, that we should do something. So I'm like, okay, I think, was it like 800, Mary? It was close to 1,000 letters that we sent out just to that Turkey Hill area. I mean, in general, people that own their house, it's not a requirement in our Board of Health well regulations that you test for gross alpha. It's not part of the basic potability test that people would test for.
But it is for new.
It's a requirement for new wells going in, and that's
And we just updated that
We
about
did.
a year ago.
There are other communities that don't have that, and there are communities like our, gonna throw it out there, where it does not have private well regulations. So we've got wells going in, and I don't see those test results, and there's no requirement to test for certain parameters. So, I didn't feel like it was necessary to send, to do a public notification to everyone, because we were only aware of these few in this area. But as you can imagine, there's a lot of people that are concerned about the results. They're willing to either spend the money. I did hear, I don't know how true this is, that somebody's putting their house up on the market in that area because of the result, that they don't feel comfortable living in the house.
Start knocking on doors, Jim.
But,
Get some business.
we're not looking to cause mass panic, because it's, we don't, we can't determine how much water you have to drink. And depending upon what your level is, how many years exposure would you even have to have in order to get the health effects from that? Otherwise, I think if it was something that was more acute and not long-term, it would be a requirement in the regulation for like basic potability. You want everybody to be testing like every 10 years.
Right.
So, I mean, it's almost like PFAS.
Yeah. Right.
It could be in anybody's well right now.
Yeah.
We're not sending out a notification for people to test for it. But if you have a private well, get it tested.
Yep.
For as many parameters as you can. But, so, I can't even remember what your question was. I'm really sorry.
Well, just a little more information on it.
Yeah,
you covered them.
I had a thought. No, I mean, really, very informative there. But it's possible that you could work around the privacy issue by getting total numbers. You know, if 100 people had tests and 13 of them wound up being bad, that is something you said you wanted to tell the legislators about. Well, that would be a number you might be able to get without knowing the actual addresses.
Yeah, I don't need to know the addresses. I was just wondering if we could get a total number of vouchers.
I
I'm
can
just
ask.
trying to
Wow.
figure that out,
See.
because if we can maybe get some more money, like there's people that can't afford to test. So if we
Right.
get maybe
Right.
more water tests and we can get these residents their tests, that would be nice for the resident. I'm just trying to think outside the box.
Yeah,
for the
yeah.
residents.
So advocating with our state representatives that maybe some support would be useful, right? For folks to think about getting tested, doing it more frequently, and, yeah.
And I'm not sure where it stops, you know, we all say Turkey Hill, but it could be other
Right.
places.
Right.
We just
Could
don't
be.
know.
Well, plus there are two Turkey Hills.
Correct.
There's 181 Turkey Hill and then out
And just like you said, mosquitoes don't know borders,
Yeah.
aquifers don't know borders.
Right, that's right, yeah, right. Water.
And it sounds like you guys are already talking about the other issue, people are calling you about with the mosquitoes and stuff.
Yeah.
I'm just wondering if
Oh,
Yeah.
that's
You're
the
on
whole
top of
meeting.
it all, so I just want to pass it along.
I think you'll be seeing
You'll
it
be
next
seeing,
meeting.
you'll be seeing a very prominent gentleman soon.
But I will call Common Analytical and see if they can get me the data, just like the street name and what.
Yeah, I
the
don't know,
results were,
yeah, sure,
I
names would be
mean-
nice, or what section. and just
Yeah.
kind of
Right,
like,
just to get it.
Like,
Total.
Right.
out of 800 wells that got tested, 750 were affected.
Yeah.
Right.
That would be nice.
Right.
That could help
Good.
catch the attention of our state
It
legislators,
would also
yeah.
give us an opinion, a sense of whether anybody listens to us.
Mhm.
Yeah, that would be nice, if you know you sent out 800 letters.
Right.
Two
Right.
people responded.
Right.
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 And as they're talking to their neighbors and whatnot, yeah.
Well, I say thank you, I'm going to communication.
All
right, sounds good.
You got it, John.
K2 communication, put out the stuff, the well stuff on the town website if you guys are interested in that too. So thank you, nice meeting you
Great,
all.
thanks.
All right, too. Our last discussion item is the public health nurse job vacancy. So, what do we got?
You didn't know? I thought you did. I thought I got an email from
Yeah.
you saying.
You're talking about
We have 2
Gerson?
minutes.
Yeah, I sent out
I
an
have no
email
bad
with,
email.
okay, yes, I sent, yes, everybody, all the district board members got that, I know you're on it.
500 emails.
Yes, August 8th was her last day.
Yeah.
She did resign, she has another job, so.
Yeah.
We're happy for her.
Wish her well.
It's just good.
But we do
Wasn't
have,
she studying? No, never mind.
so we do plan to rehire for the position. It is not out there yet. We are looking, when I say we, I did have a meeting with the officers and the district officers, the chair, the vice chair and secretary. And, you know, we did discuss paring back the hours to part-time benefits, which is what it was originally advertised for. Instead of keeping it at 37 and a half hours, paring it back down to 30 hours. And again, like I said, it would still be benefited. So a question for this board, I mean, given the services that were provided, she was just starting to do more clinics at the library, and which was not well attended, you know.
Things really well to get John on.
They do.
And you said the senior center didn't seem to need the services either.
She was going there twice a month and only getting just a few people.
Yeah.
So
So you're doing screening type stuff?
Screenings,
That-
health screenings, yeah, blood pressure.
Blood pressure stuff, mhm.
So I pared that back to
Once
once
a
a month
month.
instead of twice a month, so she could, you know, work on other initiatives. And, so she was at the senior center, she was at Christopher Heights, she was at Pine Valley, doing blood pressure clinics, wellness clinics. Like I said, like the senior center in the library. She did food truck Fridays, she would set up a table, food truck Fridays. and provide, resources, materials. I think this last event, she did a CPR demonstration, so she brought the mannequin, and laid that out, and, like to advocate for more of that training. I know she did work closely, with Chris Hogue. And she did, I believe, a naloxone distribution event with her. And some tabling events. I think she was looking to do something with the farmer's market. So, she was pretty busy in Belchertown. So we definitely, when we do hire somebody, we do want to keep that momentum going and keep those same connections established and move forward with that. A lot of our services, however, through the public health nursing, like the naloxone training and distribution, the CPR, first aid, needle exchange for substance users, was very underutilized. I spent a lot of money, a lot of grant funded money, doing advertising for the district and, including the nursing services, which included paying for the ad in the newspaper every month. I think it was going on for a little over a year. That's like almost $300 a month to do that advertising. Advertising on the Classic Hits local radio station, which reaches this area. We did a lot of advertising through them. We also had done advertising through Western Mass News. They created a commercial for us that went streaming. If you went to watch their news, you get like commercials. Some of them you couldn't skip. So that was one of the commercials that they played on there. We also, that same commercial I sent to the Belchertown community television, the Ware community television, and they circulated on there. I mean, I'm thinking of everything we can do
That's not farm.
the community forum,
The community
Facebook.
Facebook and all that.
I don't see, Kirsten had done the social media. I don't know how active she was with the Belchertown Facebook. I know she did things with the Ware Community Forum. Are you folks on the Belchertown?
I look at it every now and then, but I don't
Okay,
do
so I
a
don't know if you've
huge-
seen anything that,
a huge amount.
Anyway, the point though, I think, is it wasn't very successful. right?
it wasn't, so there's only so much,
I know,
I can do behind the scenes advertising, but then, we do need somebody that's going to be in the community more, advocating for the services. I mean, the example I use is, not all of your seniors go to the senior center. So if you're just gonna do clinics at the senior center and hoping all of your seniors are gonna touch that population, no, I mean, you could, for example, the nursing flyers, maybe you work with like Stop and Shop, because your seniors go to Stop and Shop, and anybody that looks over 65, have the baggers put like, because we can't like hit everybody. But do something like that, or get a table and work with Stop and Shop or like Big Y and set up outside there. I mean, there's other ways that we really want to see this next person be in the community to be advocating instead of waiting for an event. Like Ware doesn't have a lot of events to do tabling. And so, waiting for an event to do tabling or just focusing on like the senior center, the library, hoping you're gonna reach the population, you're not gonna get a lot of that return on investment. So, my goal is to, with the next person that we have that fills this position, to really have them be like in the community more. I mean, still keep with these monthly clinics, but
That combination of both the nursing skills and capability, as well as some of that community outreach, and like you said, I think it is a challenge. This may be an opportunity to also think about. I think all the advertising was great, but I guess I'm wondering too, other services that are comparable might be where people are going, so that they don't necessarily think about the Board of Health as that place. Like you said, if you don't go to the senior center, you don't go there, maybe it's an opportunity to get an idea of who is already doing some of these things, like you said, like the naloxone training, like other things, as good as those are. But if other entities are already engaged in that, then this person could think about, how are you maybe digging a little deeper into the different aspects of our community? Again, not just the folks who go to some of the places that are tried and true. Because I think there are, and I think getting to people, that's part of their everyday, like going to where the supermarkets are, where the drugstore is, you know, before and after school, where parents are and grandparents are dropping kids off or wherever. Where are people already in the community? Not, like you said, just at special events, because not everybody goes to a special event.
Right, not everybody.
But everybody does the daily, weekly, monthly stuff to just, you know, get your stuff done.
Colleen, how many people actually use the senior center? Maybe 1,000? I mean, it's certainly well less than the senior population.
Well,
I know they get, a lot of people come to lunch and stuff, but
not a lot of people. I mean, a couple dozen come to lunch, but many get Meals on Wheels, which is where they reach a lot of seniors who don't travel. Like, get a paper in their lunch bag or something. They do.
yeah, they may need services more than
$100 a day.
I mean, the thing that we were hearing was that because most seniors are on Medicare, they don't, and they have regular doctors. So as long as they're
Right.
doing what they, seeing the doctor periodically, they're getting blood pressure tests and those kinds of things.
Right. But it's not just the senior population.
Right.
Right, that's the
I mean,
other
like,
one
there's,
reach, right.
they
exactly.
have
I mean, yeah,
access to a lot of services
Right.
that we,
Right.
ours is just extra. It's the people that have substance use issues that are not going to the recovery center,
I saw that Amherst.
People with chronic illnesses who are under 65.
That in Amherst at the survival center, they have a doctor there 1 hour a week. We don't have anything like that, right?
like a survival center?
Well, no, a doctor who's available to people who don't have, we don't have anything like
We
that.
presently don't have a nurse.
We don't have a nurse, right? Even,
Right.
I know. And those are, like you said, people who are, especially seniors who are maybe connected, have the insurance, maybe are linked up, or friends or family, link them up to other things. But I agree with you. I worry about other age groups. I
Right.
worry about people with substance use issues, with mental health issues, with chronic illness, for whom maybe their insurance status makes it hard for them to
Right.
go to a primary care or even a convenient care, urgent care kind of thing. And then I worry about some of those younger adults, maybe they're new parents, so there's stresses there's economic issues, there's, what are they using for getting some of the kinds of health supporting services? And like you said, what's already out there that people don't know about? So maybe again, as Kirsten had been doing, letting people know what's already out there and linking people up with or communicating about what's already out there, not reinventing the wheel, but letting people know, here's where these services are, here's how you get to them, use them.
So what would you folks like to see? Because we're still, when we have the district board meeting in October, I'll have a finalized draft job description for this position. I didn't really want to call it a public health nurse again. I wanted to do something like public health community nurse and let's throw community in there. So still, the requirements would still be, we want a registered nurse because we want somebody that can do vaccinations and do the MAVEN, the communicable disease investigation work, or direct observed therapy for TB cases if need be. But I also wanted kind of like a cross between a community health worker and a registered nurse. So I didn't know if there's any public health like nursing initiatives you'd like to see more of for your community, or see this position? I mean, you can still think about it and send me, it should be an email, if you end up thinking about it after, but just something to think about, so that I can get that, worked on, so that everybody.
So in the meantime, we're not gonna have anybody until probably November.
Yeah, we'll have it voted on, because we're gonna be, proposing reducing the hours, paring it back to 30.
Yeah.
And,
A modified job description. that
Modified
has to
job
go to the
description,
district Board,
board
yeah.
would vote, and then we'll advertise and put it out there. And then depending upon like the market, who's interested, I mean, even when it was advertised originally at 30 hours a week benefited, I had like 8 applicants. It was a pretty good.
So what's the reason for paring it down to 30?
Well, we increased the hours after the first year of working at 30 hours, because that's what it was when I first started. The previous public health nurse, it was budgeted for 30 hours a week with benefits. And then when that person resigned, I just kind of kept everything the same and re-advertised. But after that first year, we added on more services, like naloxone training and distribution. We worked with DPH to be a naloxone purchasing program. We stop the bleed training, the CPR first aid training. We were advertising more heavily for that. So the, I guess, expectation was that the position would be more busy with those extra services, doing more trainings, doing more education, and after 2 years of increasing the hours each week to 7.5, it just wasn't, the services were still very underutilized. And then even at the monthly clinics, they were just underattended, despite all of like the advertising that we've done. And so.
And if I might add,
Yeah.
there is a perception that in the United States of America, there is going to be less support for healthcare. And all of the grants that we depend on for so many things, we might think about, it might be a good idea to trim early and save the money. I mean, obviously, if we suddenly got, $200,000 to fund 12 nurses or something, we would do it.
No, but if we trim money, do we save money that we can utilize when we lose that grant? That just goes back.
Well, the thing is, it doesn't seem to be a full-time job.
Right.
And that's for the 3 towns.
Correct.
And one qualification would be the person would need to be social media savvy.
Yes, that would be nice.
There's
As part of that, right? As part of
Yeah,
that
that would be good to put it.
communications role or some of that,
But now we have a good communications person.
right here in
In
town,
Belchertown,
right, so how.
Yeah, but it's also Ware and Pelham.
One question I have, when I think of any community, you think about the health of the community, you think about, who's doing well, who's needing help. Do you have a sense of how often Kirsten might have had contact with like police and fire and EMT and pharmacists? To me, those are the people in any community, and obviously our schools as well for kids, and then by extension, their families. But how much connection or letting people know through other town services what a public health nurse or a community nurse might be able to provide? I guess, I don't know, I may want to think more about it, but just that question comes to my mind. Some of those folks have a good sense of who and where and how some of those health needs are showing up. I guess I would want whoever's in the position going forward to at least maybe have some periodic conversations with those folks. Doesn't mean their scope of work has to change, but just to get an idea of what are the people who also have eyes and ears on the community seeing every day, every week?
She was involved, with the fire, the police. She was involved in a lot of, like coalitions,
Okay,
like the Domestic
those
Violence
same
Task
things,
Force,
right,
for
right.
example, and usually there's police representatives, so she
Yeah.
attended those meetings, was
Right.
connected that way. Same thing with, the senior centers, both in Belchertown and Ware had the triad
Yep,
meetings.
yep,
Usually you
good,
have someone
okay,
from the police there, or
Yeah.
I think the district attorney or the
Right,
attorney general
district
there.
attorney, yeah, district attorney's
So she
office,
was
yeah,
connected,
good, okay.
you know, with them through those organizations. Even just working, as part of her job also was working on the emergency preparedness plans and
Right.
updating them for the towns
Good.
for emergency dispensing sites. So she had been in communication with the fire chiefs because they're the
Yeah.
emergency managers. And even in the beginning, we promoted like TB testing, so she reached out to the fire departments because usually your EMTs and any new ones might need to have that TB test, and sometimes it's kind of a pain going to your primary
Right.
versus she could go
She
right
could
there
just
and
do
do
it,
the test and then
right,
follow
right.
up in 48 hours. So she was definitely
Okay,
connected
good.
with
Okay.
them. How often, I don't know.
Mhm.
But I know that, you know, and plus everybody's busy, so it's, unless there's like a specific issue going on, you know what I mean, where the communication was needed, but I don't know how often the outreach went to those individuals in regards to reminding them about the services and.
I guess I'm also thinking too that, and I think all of that is great, and I think going forward, you know, that kind of work where it's not necessarily directly clinical, but people are getting to know, so whoever the new person is will need to potentially get to know those people, all those services. And then there again, those folks are in a position to let people know about what the public health nurse or a community health nurse might have to offer that might be of benefit to them. Especially if they don't have insurance, if they don't have primary care, if they don't have other avenues for.
And that's where I don't know, so if we have like an EMT doing all of these calls, I know Kirsten had outreached to, the DART officers, because if they responded to an overdose, she wanted to go on that post-overdose visit. So that, you know, public health nursing would be representative, because otherwise if they go back and it's just with the police officer, like the DART officer, it kind of, the nurse would like soften that visit. And then she could connect that to other services.
Right.
Because I think Hampshire County Hope was doing it. And I don't know if they had discontinued doing those post-overdose, but they were connected with one of those organizations, but she wanted to kind of dovetail off of that.
Good.
But it wasn't, but again, like we don't get informed when they go out on those visits, so I
But
don't
maybe
know.
we could ask to be informed.
And she did.
Oh, okay.
But it's either the visit was, or maybe there wasn't any post-overdose visits that they had to do, which is a good thing, you know, we kind of don't want to have to keep
No,
going.
but I mean,
So-
it's good for us as an organization to be working with
Right,
EMTs.
it would just be kind of sending like a reminders, hey, I know she did do one post-overdose visit in Ware with the DART officer. But she did outreach, to the officer in Belchertown, but she never went on a visit, so either it just wasn't needed.
Well, and I think, you know,
Whatever.
the challenge is a lot of needs in
You gotta
a
put
small
yourself out there,
community.
you gotta sell your services, put yourself out there, and you kind of have to be aggressive with the social media, putting things online and getting out into the community. And that's my hope. When I hire somebody, I want somebody that's driven to do that.
Minutes?
Okay, yeah, our regular business is to review the meeting minutes of July 28th.
I move that we approve minutes of July 28th, I think as amended, if I'm not mistaken.
Yes. Do I have a second?
Second?
All in favor?
Wait, Mary, we went.
She has a warrant to sign.
Oh, okay, no, we don't
Yeah.
have, we can continue with the minutes. Okay, I'm sorry.
Yeah.
Yeah,
No,
I made the motion, Gail
I
seconded.
seconded for the July 28th minutes.
I
All
should
in
probably
favor?
abstain. That was in here.
Yeah.
I
Same with me.
I was here.
passes
I abstain.
2-0-1-2.
202. And we got one warrant to sign.
Yeah, please go ahead to them myself, Henry. Oh. Oh, I wanted to, okay, I can ask you this question. I got a request today. I don't know if you remember Anthony, who did the original nicotine. This morning, he asked me for a copy of our Kratom regulations because he wants to present it to his town, which is Brooklyn. I found a copy of the draft. Did we approve the draft as it was? Okay.
Yeah.
Because I know that.
It's not online, did you check the website?
I didn't check the website.
I looked, I probably didn't look in the right place. I looked on tobacco regs.
I'll have Mary send it to you.
Okay. No, well, I have a copy of it from
Oh,
the,
do you have a signed copy?
no.
Okay. The
Okay,
board
yeah,
membership,
that
it's
was.
a regulation.
Guys
Okay.
read signed, yeah.
There are now like half a dozen towns that have approved it. We were the first. And so getting some momentum there. I think I mentioned Belchertown resident had a relative who died of it.
Oh,
Were they living in?
Not in Belchertown, somewhere else.
Yeah.
Serious stuff we deal with here.
Okay.
Are they on? They should be on.
Yes.
Okay.
You said you never.
Okay. I'm very proud that we did that regulation and the documentation was great. And really, I was like,
So, South Hadley's having its public hearing on the second Tuesday, September 9th. And Gail, you give the same presentation you gave to us, to them, and probably sell it. And you did Amherst.
yeah, how are they doing? Are they got some?
They're not doing anything, but a lot of people will really take the summer off. I'm going back on. But I figure if South Hadley passes it, that's a good opening
Yeah.
for Amherst and
Yeah.
Northampton to get back on the. And
You're talking
Montague
about
looked at
nicotine
it
free,
like
right?
a year and a half ago, and they just sort of went into the ether too. So we gotta catch up. Meanwhile, Leverett had said they were gonna do it. They haven't yet, so I followed up with them as well.
I think it'll be tough because a lot of nicotine sellers, where Pillow was no problem. They had no
I know,
sellers.
Right.
Right.
It's gotta get rare.
Yeah, right.
Well, we're talking about where. It's very variable, you know. You get some of these towns that you'd expect to jump at it. You'd expect Northampton and Amherst to jump at it. Not some of the other places.
Well, I think it's like you said, the
It takes.
places that have a
one of the
lot of money,
things-
people who have a lot of retailers,
Yeah,
that
right.
they get the
Right.
pushback.
I went to Pittsfield, we thought we had the votes, and they voted against it.
Mhm.
And I went there with my 15-year-old grandson, who told them about his high school friends who vape. And it didn't matter, you know, there was some political background nonsense about, oh, these people who only own 4 or 5 convenience stores are crying poverty, you know.
Well, that's always,
Meanwhile,
that's always.
you know, these people die at 45.
I know,
Right,
but that's always
right.
been the push and pull when
Right.
it comes to any of the
It's all
substances that
politics.
that are legal.
Who's on the board? And what
And who's on the board, right?
Yeah.
The MDs voted against
What?
it. MDs voted against
Medical doctors? Medical doctors, but they can sit,
Who did the tobacco industry hire to be their
Right.
spokespeople
Well,
in
they
the
had- they
fifties?
brought
Medical
in-
doctors,
exactly,
right?
Exactly.
They used
It
medical
wasn't even a
doctors
public
to
hearing, it was a
persuade that,
discussion of whether to hold the public hearing.
that something
And I showed
was
up. I
unhealthy.
drove out to Pittsfield.
Wow.
But you keep going, and they had their own issues. Oh, we're so close to the border, they'll just go to New York State to buy it,
eventually
They're
they
probably
just.
doing that anyway, so,
And that's true until New York State gets on board,
But meanwhile, we've got 500,000 people in Massachusetts who are under nicotine-free generation.
Mhm.
We'll be getting that.
Takes a while for a new idea to,
Mr. Chair, do you want an adjournment?
I would like, someone to, make a motion.
Who wants to move to adjourn? We're having such fun here.
Oh, I would do it during class meeting.
I guess I'll
See
second
you in
it.
September.
All right, all in favor?
Aye.
All right. Please pass. It is 7:35.
And now Mary and Andrea can go home.
the rest of you are staying overnight? Is that your
Who's
plan?
camping out? Oh, yeah, you.
It's the benefit of the select board.
Does the gal come and do that anymore?
This-
Do we record